Hirsch, and this is EdCast, a program created and produced by educators for everyone interested in education. In future years, we will all remember where we were during COVID-19. The worry, illness, and isolation caused by the coronavirus is not something we will soon forget. Our children are also suffering. They are listening to news reports they cannot completely process and dealing with a school year that has been chaotic, not only for them, but also for their parents and teachers. Much has been lost academically, and the long-term effects of the pandemic are still unknown. What can we do to help our children cope right now? Today, EdCast speaks with an expert on childhood trauma about what we know about the impact of COVID-19 on child and adolescent mental health, and what we can do to help young people deal with the strains and anxiety caused by the pandemic. Coming up now on EdCast. Joining me today is Dr. James Rodriguez. He is Director of Trauma-Informed Services at the NYU McSilver Institute. Dr. Rodriguez is a New York State licensed clinical social worker and psychologist with over 25 years of experience providing mental health services to children, youth, and families. He is also an adjunct faculty member and teaches cultural competence at the NYU Silver School of Social Work. Thank you so much for joining us today on EdCast.
And thank you for having me, Linda.
You're welcome. The COVID-19 pandemic, as we know, has really affected many adults, both physically and mentally. But I believe, our children are suffering as well. What do we know about the effect of COVID-19 on the mental health of children and adolescents?
Yeah, and it's a great question, a great place to start. So, I think what we do know, I'm not seeing a lot of data yet coming out directly assessing or evaluating the impact on children directly. However, we do know with the available data coming out of the CDC and other sources that parents and adults are experiencing high rates of depression, anxiety, trauma and stress-related disorders, substance use, and suicidal ideation during these times. And so one of the other things that we know in the mental health field, in the children's mental health field especially, is that the impact and the mental health of parents will often have an impact on the mental health of their children. And so there are a number of different ways in which children's mental health is impacted, and we can predict that we'll see higher levels of these mental health disorders among children as they return back to school and come back to some sense of normalcy through this process. So we can expect those things, but we also, again, know that there are other children who are being directly affected, of course, right? So children who have experienced the loss of a loved one or a loved one who got sick as a result of COVID-19, those who are living in conditions that make isolation, social isolation, and at-home orders or stay-at-home orders more difficult. So there's a lot of these secondary stressors that kids are experiencing, some kids are experiencing, and that's right, unevenly distributed in many ways. But we know those are additional stressors, and that the impact of those direct and indirect impacts or secondary impacts and direct impacts of COVID-19 are affecting children and will have an effect on them for a long time.
So we have children who you pointed out are really dealing with super stressors that are caused by things happening in their world. As you said, deaths, worrying about parents. We did a show about a month or so ago on online learning, and we had a kindergarten teacher on as well as other teachers. And he said that for his kindergarten kids, a lot of them cry when they're on Zoom because they think that all the other kids they see are together except for them. So there are so many things that affect children, I guess, that we don't even realize. Down to wearing a mask, I suppose, that can be scary. But you were really talking about some of the really particular stressors that some kids experience. How does some of this stress manifest itself physically? Or does it manifest itself physically as well?
Well, yeah, it absolutely affects children and adults. So stress affects everyone physically and mentally, behaviorally, in a variety of ways. And so, without taking a deep dive into the human stress response, what we know is that when we experience stress, any one of us, our human stress response is activated. And what that means is the body begins to produce cortisol and other stress hormones to really prepare the body for that response to whatever the stressor is. And that's normal, that's baked in, that's part of our biology, and in many ways, a necessary part of life. The problem is that when you are chronically exposed to this stress through, for example, a mass disaster event, which is the only way to characterize the COVID-19, what's happening with the COVID-19 pandemic, that's generalized throughout the public. So we are all obviously, as we've talked about, exposed to this stressful, ongoing stressful situation that keeps us in this constant state of stress. And that goes for adults and children as well. And, and it's an interesting thing because on the one hand, for adults, it can be, of course, this ongoing stress that impacts, to your question, our physical health. So it can result in headaches, problems with sleeping, problems with eating and appetite, overeating, undereating. So in many of these ways, other somatic symptoms, stomach aches and gastrointestinal problems, but of course also, as I already mentioned, our mental health as well, depression, anxiety, and stress-related disorders. And so again, all of these impacts, and we know from studies of exposure to chronically stressful situations that these are what we can expect are the long-term effects of that exposure to either trauma. And again, as I said, in some cases, it may be traumatic experiences or traumatic grief experiences for some kids that are kind of a direct result of COVID-19, or again, these secondary effects and exposure of constant stress.
I want to move that forward a little bit because you're talking about, as we said earlier, some of the unique stressors that kids can experience, the more severe. There also are groups of children in our society. I think I've looked at some of your writings and your workshops that we really see suffer additional stressors, and that of our kids who experience poverty and racism on an ongoing basis as part of their lives. Can you talk a little bit about that?
Yes, of course. And I'm so glad you're bringing attention to this because, as I said, there are groups of kids that are more vulnerable to stress, or again, have added stressors that can overwhelm their ability to respond and adapt in resilient ways. And again, so when we think about the exposure of kids to some of those secondary stressors, as you mentioned, poverty, homelessness, joblessness, unemployment, that are all the direct impact of COVID-19, access to healthcare or lack thereof, access to quality education. So all of those things have an impact. They're what we call the social determinants of health. All of the kind of non-biological factors that can impact a person's health, physical health and mental health. And so we know all of those things are at play in COVID-19. And then the other piece that you're bringing up is that things like those social determinants of health, like economic stability and housing stability, and again, access to quality education, are unevenly distributed in society, right? So there are some groups who have a lack of opportunity or access to opportunity or access to the services that they need in society that can make all of this, again, more stressful and make them more vulnerable to the impact of stress, and therefore also more vulnerable to having more traumatic experiences related to COVID-19. And again, those are people of color, those are, and also we have to remember people of color, women, members of the LGBTQ community, and then of course other groups as well that intersect with that. So healthcare providers, right? So the other thing that we know is healthcare providers, oftentimes disproportionately people of color who are those essential workers who have to continue to work because they don't have the capacity to take time off or to furlough themselves or whatever, and they have to maintain, who are again, oftentimes people of color, oftentimes women of color, to engage in that, and again, are being exposed to this constant stress and higher levels of stress than others in society.
It's interesting because so many kids, I think, worry about their parents getting sick, but those kids who know that their parents are in a hospital situation or in a frontline spot, they must worry so much about their parents being well. I mean, because, so many kids are worried about that. So I want to go to school then, because we are having our children return to school one way or another. I want to even take a step back. It's the open and closed nature of school. I know parents want their kids back on the one hand, some parents don't, but what do you think about the way we've been opening and closing schools? Is that adding additional stress, or do you think kids can cope with
Yeah.
that? What do you think?
Well, well, the first thing I want to say in terms of coping is I do want to remind folks, and this is a critical piece, that kids are in fact resilient. We all are. We all have resilient capacities. And so one of the things that I do want to highlight is that even though I talk about the impact of stress, chronic stress, and trauma in people's lives and in children's lives, one of the things that we know about that is that, again, the majority of people, including children, are able to adapt. And so, adapt, meaning sort of with difficulty, right? So that doesn't mean that we're immune to the stress or the effects of stress. It's just that we have coping strategies and ways of dealing. So it's important to understand that first, and that there are those capacities. But in terms of what schools can do and what schools should know is that there is this possibility, likelihood. And so when again, my work is in trauma-informed care, so we often talk about understanding how pervasive trauma and exposure to chronic stress is, as well as what the impact can be, so that we're responding in many ways as if we can assume that most kids are going to be experiencing some level of stress, and maybe higher levels of stress because of those additional exposures to more and more adversity in their life.
Yeah.
I think that's part of it, a part of that understanding, so that we can identify ways in which we can help all of those kids who are sort of experiencing what I might normally call garden variety stress. I think there's garden variety stress right now. In my pre-COVID-19 talks, I often talk about garden variety stress, which is the kind of stress that we all deal with on a day-to-day basis, right? We all have work struggles and family struggles and, financial concerns or whatever it may be. And those definitely trigger the stress response. But again, these are not normal times. But in many ways, you have some kids who are experiencing, higher levels of stress, but I don't think anyone is not going through any form of stress at this point. The important thing is to recognize what are the groups, right? So you have most kids, almost all kids who are experiencing some level of stress. The unpredictability, so I'm sorry for the sort of long-winded way of getting back to your question, the unpredictability of whether I'm going back to school, the unpredictability of interrupted routines that are critically important for kids to learn, to feel safe, all of those things can interfere with their ability to cope, and are constant sort of stressors that make adapting very difficult. So yes, absolutely, unpredictability does not really work well for children in terms of being able to learn how to cope. That doesn't mean that they're not going to cope well and they're not going to be able to adapt. It's just an added stressor. And oftentimes, one of the things that we talk about, whether we're talking with parents or teachers, is the importance of routine, predictability, and building that in.
Right.
So to go back to your original question, yes, that's going to happen, but thinking about it from a trauma-informed perspective and a resilience building perspective, you want to try and build as much predictability and routine as you can, and that has to be a focus.
Now, what can schools do? I know we talk about building resilience and dealing with trauma. What are some of the things we can be looking to see that our schools are doing to help our children?
Yeah. So I like to simplify it. So the notion of building resilience can be very complicated and complex, and there are many different ways of thinking about resilience and sort of different factors associated with resilience. I like to boil it down to three things, and especially when we're taking this trauma-informed lens and resilience-focused approach, is three things. One is safety, right? So again, what we all need in these times is a sense of safety. The second thing is the ability to cope with and regulate our thoughts, feelings, and behaviors. And the third thing is connections. So and I simplify it that way because, again, if both teachers and parents, whoever it is that's working with children, are just focusing and making sure that whatever they do, whether you're setting up routines, having discussions with kids, of course, your classroom routines and your lessons, all of that, if you're paying attention to those three things, you're taking huge steps in helping kids to develop resilience. And then there's more specifics to that. So of course, as I've said, safety. In many ways, we can build a sense of safety and help kids feel safe, as we mentioned earlier, through the routines that we develop and helping as much as possible to develop routines. Of course, in the COVID-19 era, safety also means teaching kids all of those practices, those healthy hygiene practices that keep them safe from the disease and from the virus. So those kinds of things that are critically important. So routines, maintaining those, talking about safety, reassuring messages. And when I say reassuring messages, I mean finding that balance, right? So on the one hand, you don't want to give kids messages like, you know, if you don't wear your mask, you're going to get sick and you're going to die. I mean, I know that's an extreme example, you know, and on the other hand, right, you don't want to sort of reduce the risk or minimize the risk, right? So, you know, you don't want to say things like, it's okay, everything's going to be fine, don't worry about it. You want to find those reassuring messages that are somewhere in the middle, right? It's important to stay safe. The things that you can do to keep yourself safe and others safe are things like wearing masks. So reassuring messages and letting them know that there are adults in the world, the parents, their parents, schools, doctors out there are all trying to figure out how to make everyone better during this time. So that's the safety issue. And then, as I mentioned earlier, the coping strategies, what you can do to integrate coping strategies are really a broad category. I can talk about so many of them. Ultimately, yeah.
If I'm a parent now and my child's back in school, are there certain things I could be looking for that I hope the classroom teacher is doing or that the school is doing to help these kids deal with stress?
Yeah, well, again, going back to these sort of three pillars that I like to think about, it is those things. Again, talking about safety and reassuring kids, also helping them regulate. So I would want to see things in the curriculum, things like relaxation time, mindfulness activities that they can do. And again, I'm not saying sort of they spend the whole day on it, but mindful moments at the beginning of classes and at the end of classes. Having a place in the classroom or at home where they can have like a safe space if they're feeling dysregulated, if they're feeling overly emotional. Those kids that you mentioned earlier in the kindergarten or preschool classes that are crying, you know, and it's difficult, but finding a way to sort of identify those things, address those needs, and work with the parents to give those kids a break if necessary, allow them a space where they can go and cry. But again, those kinds of ideas of having kind of a safe space to go in the classroom to be able to, when you're feeling dysregulated, go and get back into some level of equilibrium. And those things can also be very simple, plush toys or just music that they can go to listen to calm down. Whatever it is that helps them to get themselves back into some sense of balance and regulation is critically important. And then the other piece is connections. And again, I know in this day and age with social isolation, that's incredibly difficult because most of our connections are through the web and Zoom and all these other platforms. But really helping kids think about how they can maintain contacts with their friends, maintain contacts with family members, right? So you can have kids, and I think you gave the example earlier, sometimes kids are worried about their family. They're worried about their extended family. They're worried about grandma and grandpa. They're worried about their own aunts and uncles and cousins because they don't have contact with them as well. So encouraging those contacts to make sure that kids feel connected to family. And then, of course, also whatever you can do to build fun activities for kids to be able to interact with each other. And of course, we have to be mindful of, again, not everyone has access to the internet. So phone calls and other ways in which you can encourage kids to maintain those contacts with others because, of course, they're critically important in this age of social isolation.
You're right to mention, the online environment, I'm sure to me it's like an added factor, for children. It's so hard. They don't see each other. They go into school one day a week or maybe twice a week. And now in terms of their academics, I know I read somewhere that low income parents especially are really concerned that their kids are falling behind academically. Have you seen anything or is there any talk about how all of this is affecting kids, both the whole disruption of the education, the anxiety? Are we concerned that kids are going to fall behind now?
We are, and I came across a study recently that was looking at predictors of the achievement gap widening for certain kids. And one of the things that they looked at that was interesting, right, is that sort of they looked at the loss, the educational loss that sometimes comes from, for example, our natural breaks, right, summer breaks. So anyone who works out there in education, Linda, right,
Right,
everyone
right.
out there who works in education knows, right, you know, for some kids, you know, that summer break, they come back and there's some loss in educational attainment, reading levels, or math. Okay, so we know that, but this study was kind of looking at, so if you take that kind of loss and kind of push the trajectory out and lengthen the amount of time from a summer break to a much longer break, what we can, and of course, as they show, that the trajectory, the estimated trajectory of the gap and the loss in educational attainment increases over time. So there's that expectation. But of course, anybody with 2 eyes and 2 ears knows, right? Those kids who don't have access to quality, you know, computers and remote access and all of those, you know, are of course going to be falling behind. So yes, it's in many ways, some of the science is showing that and some of the research is showing that. But again, we all kind of, anyone who's out there in education knows it's growing. So it's a major concern. And I bring it back to, again, some of those factors. So you have this increasing education gap. So what's going to happen, right? So you're going to have some kids come back, and let's say we get to some new level of normal, they're going to come back, they're going to be behind. They're going to be behind their peers who maybe, again, have had access to good education, maybe had, you know, a parent who can really help them and can have some continuity in their education. Maybe they're kids who have parents who created those pods that we're all learning about, right? So some of them may actually be doing well. And then you're going to have the kids who are going to be struggling. So they're going to come back and they're going to feel, obviously, lower sense of self-esteem, comparing themselves to others and seeing other kids doing well and them being stuck. Again, these things lead to those poor mental health outcomes, can lead to depression, anxiety, performance anxiety, so on and so forth.
As far as you know about New York City, you know, let's just start with our own city. Are teachers getting any special preparation for dealing with all of this?
Yeah, that's a question I am not really capable of answering. I've seen that there are attempts. What I have a sense from seeing some of just the commentary on, you know, sort of, you know, daily news sites, not the research literature, but in terms of daily news sites, is that, yeah, that teachers do feel unprepared. You know, and we have to remember that for many teachers, again, this remote learning these remote learning platforms are new skills, new ways. So that's an added stressor for them in terms of, again, gaining a better understanding of how to do this. They're learning as they go. And in many cases, and you may have some who are really good at it, but many who are struggling with it. So we know that's an added stressor on them.
We only have a few seconds left, practically. I want to just ask you my
Oh,
last
goodness.
thought.
Where did the time go?
I know the new normal seems like it's going to be with us for a while. So any just last words on what we can all do to calm down and to cope? All of us.
Um, I think, well, so, you know, one of the things I like to say, Linda, is that when it comes to coping and dealing with stress, I like to say it's not a one size fits all. Oftentimes, you know, what works for one person doesn't work for another. For some people, it might be meditation and yoga, mindfulness activities, listening to calming music. For other people, it may be listening to salsa music or dancing or, you know, so one of the things that I think is so first is being aware. Self-awareness is critical. Be aware of, and we know ourselves best. So we know what our breaking points can be. We also can recognize our own self-awareness and when our anxiety levels are increasing. We need to listen to our bodies. You know, Bessel van der Kolk, a major sort of researcher in this area, right? The body keeps the score. Oftentimes, right, we need to be aware of ourselves and then identify those things that help us cope. And again, it can be different for different people. Those things that help us, in some cases, distract ourselves, in some cases, bring our emotions back into some level of regulation, in some cases, get us to think about something differently. Or so there's a lot of different ways of doing this. And unfortunately, I don't like to give kind of the definitive answer. It's more important to know, again, what your limits are when you're feeling stressed out, And then also accepting it and normalizing it. I think I will say this, one of the worst things that we can do is that we begin to blame ourselves and feel like we should be handling it better and feel like we should be coping better. And I think that's definitely one of the signs that you should work through those and certainly address those things, because ultimately, that self-blame can only lead to worsening symptoms.
Thank you so much. Good advice for everybody. I certainly will have to find some coping strategies as well. Thank you so much for joining us today on EdCast. Dr. James Rodriguez, a pleasure to have you here. So thank you again for joining us. Don't go away. We'll be right back with our Ed Bites.
Thank you, Linda.
Welcome back to this edition of Ed Bites. There is no good news regarding the reading ability of high school seniors. District administration reports that their average reading scores declined between 2015 and 2019. According to DA, just 30% of 12th graders reached or exceeded the academic benchmarks for reading that would qualify them for entry-level courses. The online remote instruction necessitated by the pandemic is expected to reduce learning for most students, but our youngest learners might suffer the worst effects. The lack of face-to-face kindergarten is expected to produce serious setbacks for these children, especially those from low-income homes. Kindergarten is the time to learn by doing, and social interactions are key to children's development. Neither of these is facilitated in the online environment. The Hettinger report notes that many, if not most, of this year's kindergartners will enter first grade knowing less than they would have in previous years. We might be approaching consensus as to the best way to teach reading. Education Week reports that the Teachers College Reading and Writing Project, designers of one of the most popular reading programs, outlined a new approach to teaching children how to read. Criticized in the past for its de-emphasis on phonics instruction, the group now calls for an increased focus on teaching children to recognize the sounds and words and linking those sounds to letters, a foundational reading skill. It also encourages sounding out words as a key reading strategy. That's it for this edition of EdCast. Thanks for watching and stay well.
We'd like to hear from you. Please send your thoughts and comments to CUNYEdcast@gmail.com.